Good afternoon, ladies and gentlemen, and everyone who's watching. And today, we have 5 students who are going to talk about their home country, the medical ethics in their home country. Basically, medical ethics is a branch of ethics that analyzes clinical medicine and related scientific research. I'm personally from Egypt, even though I don't live there, but I really would like to start with someone who's going to talk about my home country, which is Hania. Hania would be our first guest today. Hania is living in China, even though she's living there, but she would like to talk about Egypt's medical ethics. Welcome, Hania. Hania, can you give us an overview about medical ethics in Egypt?
Hi, thank you so much for having me today, Bassem. I'm very excited to be sharing about medical ethics in Egypt. So medical ethics in Egypt goes around about 62 points in particular. And the first one would be the oath that medical students are required to do before they graduate or on their graduation day. And this actually allows them to practice because without that oath, they are not allowed to practice. And second chapter would be, they're basically all 4 chapters. So the second chapter would be the doctor's roles or how do I say that? Doctor's responsibilities. First would be towards his community uh, or her community. Second would be towards the patient, towards their colleagues, and towards the job. So basically towards the community is when a doctor finds that there's like an infectious disease or anything, they're supposed to report it to the authorities. And next, which is towards the patients, is to not give any consultation outside of their specialty. If a doctor is a pediatrician, they just keep like only treat pediatric patients. And towards the colleagues, in Egypt, it's very common to see clinics, not just doctors don't just work for the hospital. So yes, so for example, if I'm a doctor and I asked my colleague doctor to sub in for me because I'm going on a vacation or I'm taking some time off or studies or anything, the doctor is not supposed to take my patients, and he or she is supposed to tell them that they are just here subbing in for me. And then last but not least, towards the job, is doctors are not supposed to market for themselves. If they open a new clinic, they can market for themselves only 3 times. And also, doctors are supposed to behave and act like professionally, so because they are representing the medical community in Egypt.
That was a really good introduction about medical ethics in Egypt. And moving from that, do you think the culture is the reason why in Egypt you have the special interventions, ethical points?
Oh, that's a very good question. Yes, it does. Because mainly the three medical intervention ethical points. First is the transgender or the trans correction surgery. So trans correction surgery is not allowed to occur unless it has been approved by the medical board. And also the patient, he or she has to undergo hormonal testing and therapy for not less than 2 years. Doctors who do not like get the acceptance from the board and they just do the surgery anyways, they can be actually get like a case, like a lawsuit. Second would be impregnation. So surrogacy in Egypt is not allowed by any means, and that's definitely because of the culture. Because in Egypt, it's not very common to see young women and men having kids outside of marriage, unless it's adoption. But yes, so the doctors are not allowed to impregnate a woman by anyone that's not her husband. And even if they are together but there is no marriage certificate, that would make it illegal to impregnate a woman. Third is the transplantation surgery, and this, it doesn't really have have many ethical points, just that the form should be submitted and consent is the most important point.
Would you say that the doctors there follow the ethical guidelines 100%?
Yes and no. From a personal experience, I've seen that doctors follow the ethical points because this can lead to lawsuits if they don't. Like, for example, if a doctor said a patient's secret, so yes, that could lead to a lawsuit. However, I've also seen doctors that, especially during the pandemic or with severe cases, so I've seen doctors that they do not really follow the guidelines 100%, especially with medicine, even though it's very it's one of the points in the ethical guidelines that we cannot use anything. We cannot use medicine for research purposes on patients. But I've seen some doctors use medicine that has not yet been approved for cancer patients. And I've also seen doctors that during the pandemic, they have been treating patients that's not their patients just so they can keep them safe and stay at home. And also giving out medical advice for their non-patients just so they stay safe. So it's a very yes and no. It's like 50-50, but mostly yes, doctors in Egypt follow the ethical guidelines.
Thank you so much, Hani, for talking about Egypt.
No problems, Basim.
That was really great information about medical ethics in Egypt, which I personally just learned today. And moving from that, from Africa to Asia, we have a guest. He's actually not with us today, but he has sent us a video talking about the medical ethics in his own country, which is Bangladesh. Let's listen to it together.
Hello, this is MD Yasin Arafat from Bangladesh. I am very much thankful that I can say some words about clinical ethics of Bangladesh. Bangladesh Medical and Dental Council is the body to regulate the conduct of the medical professionals of Bangladesh. After graduation, we have to register ourselves with the council. We have to agree to abide by the codes of declaration. The declaration of codes is I pledge to consecrate my life to the service of humanity. I will not use my knowledge contrary to the laws of humanity. I will maintain the utmost respect of human life from the time of conception. It also includes responsibilities, physician, professional service, duties of the physician to their patient and to each other, public and the profession at large. In the other way, this code of ethics is divided into different sections. Each sector deals with different issues, namely duties of physician to their patient, duties of physician to their profession, duties of physician to another physician. Medical ethics in research is dealt by a separate organization, Bangladesh Medical Research Council, which regulates research concerned with clinical, epidemical and sociological aspects of health and diseases. It also includes drug trials. In Bangladesh, medical services are provided by public and private sectors. In public sector, there are scarcities of amenities and beds. It is overcrowded and the physicians have to face the ethical dilemma in their choice of treatment and priority. In private sectors, it is costly and beyond the reach of good people. There is a lack of good monitoring and proper laws. In addition, advancement in transplantation and assisted reproduction necessitate new regulations of medical ethics. Bangladesh is going through a social transformation economic growth, and increasing disparity, widening of gap between poor and rich, increasing literacy, empowerment of women, increased health awareness, increasing life expectancy, decreasing infant mortality, and maternal mortality. That's all about clinical ethics of Bangladesh. Thank you.
Thank you for our friend Yasin Arafat to give us this information about the medical ethics point in Bangladesh. And moving from that, let's go to another country. Let's go to Thailand. We have our friend there, Teresa, to present for us the ethical guidelines in Thailand. Let's start with the first question to Teresa. Teresa, do Thai citizens get health care free?
Okay, so in Thailand there's government healthcare, and it is funded by Department of Medical Service at Ministry of Public Health. So Thai citizen who has a low income or who have their universal coverage card, as known as gold card, are free of charge, except on Saturday where the charge are made. But compared to the United States or Western or even in Europe, the medical service or medical care is still cheaper in Thailand.
Can you tell us more about the universal coverage card?
Okay. Okay, so I'm so proud to say this because I'm from Thailand, and Thailand is the first transition country in Asia that introduced universal coverage in healthcare in 2002. And the universal coverage card is one of the largest healthcare program in Thailand. So basically, the Thai government will provide affordable price healthcare for Thai people, which is cost about $1 per visit, or it is about 35 Thai baht per visit approx, which is reflected by high share of public expenditure when compared to neighboring transition countries.
I see. But do you think that universal coverage card is needed, since that the health system in Thailand is really cheap?
Okay. Okay, so this is just about my own opinion, so there's no right, there's no wrong in this, okay? So I think the universal coverage card is needed because it provides the affordable price healthcare for the poor, and no matter how much the doctor want to treat the patient, but sometimes the treatment costs a lot, and yeah, there's still a payment to be made, so it is needed to help with the poor, obviously. And the universal coverage card is even cover for the entire viral therapy or even other chronic disease. So sometimes if you go to the private hospital, it's gonna cost a lot, and not everyone can afford a good healthcare. So it is needed. It is needed to help with the poor.
Right, so far, what do you think about the medical service in Thailand?
Healthcare in Thailand is generally of good quality, especially in Bangkok. The city has a thriving tourism medical industry, and there's a lot of hospitals that offer excellent healthcare in affordable price compared to Europe or Western or even in the United States. So yeah, it's good here. There's a many hospital good here, and a lot of them are so famous.
Speaking in medical service in Thailand, is there a problem culture in Thailand in medical service?
According to the research of overall medical ethics in Thailand, the research is published by Dr. Methanadon Pikun. It says that Thai culture has enormous influence of the treatment for the patient in Thailand. And the concept of human right is still alienward in Thailand, even though Thailand has a more flexible and more loosely constructed in Thai society. But Thailand is a country full of religious and supranational values. So the roles of families, members, or relatives are so much more important. Sometimes the patient is the last person to know about their own conditions or even their own prognosis because it is inadequate to inform the caregiver and cause the least pain and pressure to the patient and the caregiver or the family's member. And the word is called เกรงใจ which is one of Thai word that doesn't exist in English. Yeah, we can't find the meaning of this word in English.
What about religion? Is religion involved in the medical care and ethics in Thailand?
So you might know about this already, but Thailand is a land of Buddhism. But still, it is not possible to add the whole Buddhist doctrine. But as the understood and believed of the Theravada community in this modern society, the Buddha explained his teaching was like a medicine, and it is needed to be administered to the patient for the elimination of suffering. So to ignore the Buddhism in medical service or healthcare will be very unwise.
Thank you, Teresa, for sharing with us this information. And moving from Thailand in Asia, let's go to Ghana in Africa. We have Christopher in Africa, and he would like to talk about the medical ethics in Ghana. So Christopher, how would you describe the ethics in your country, Ghana? Would you say it's satisfactory?
That is an interesting question you have asked. The answer is not necessarily straightforward. Healthcare in this country falls into both the public and the private. That is, it is run by the government and private individuals respectively. And the general notion is that private healthcare is better. It offers better quality, better wait time, and just a better environment. The locals say you enter a public hospital and leave it worse off, but you enter a private hospital and you feel better even before you have met your doctor.
But if I'm right, that because private healthcare costs more.
Yes, it is quite costly because standard consultation in private hospitals is about 150 to 200 cedis, right? And it's important to note that low-income workers make about 500 to 1,000 cedis, right? So that means consultation alone is about 20 to 40% of monthly income, not including medication and tests, right? So as a result, majority of the people prefer the public sector hospitals, right? And as a result, the public sector or hospitals within the public sector are highly congested and swamped.
And how has this affected healthcare professionals and patients?
Yes, the locals I've interviewed are highly agitated and frustrated with the public healthcare or public hospitals, especially the ridiculously long wait time. Some say they spend the whole day within the hospital only to have to come the next just to meet a doctor. And these hospitals are run 24/7. There's always a doctor available. That's just how serious it is, right? And the current COVID pandemic has not helped matters as it has put a lot of doctors out of commission. The only industry benefiting from this is the herbal industry or the herbal local medication industry. That's herbal medicine, right? Most people prefer this, or most people are going to this industry because the medicine is cheaper, it intrigues to a traditional route, and it is over the counter. You go in, you get it. Simple.
What about the doctors?
Notwithstanding the current COVID pandemic, the public sector or hospitals run by the government are run at a massive loss. And as such, the National Health Service is highly indebted. So as a result, doctors' allowances and benefits are greatly reduced and they are also delayed. This has left them very frustrated, and this shows in some of their daily patient to doctor relationship, with some patients describing the doctors they meet as cold and stoic. But this does not apply to all of them, as some are still described as compassionate and loving.
Can you tell us more about NHC in your country and its depth?
To answer your question, the major source of finance for the National Health Service in this country is the National Health Insurance Levy. This levy is 2.5% on all goods and services sold and rendered in this country. This alone constitutes about 75% of the National Health Service Fund. At the moment, the National Health Service is believed to cover about 95% of all diseases that afflict Ghanaians, and the current debt is in excess of $50 million.
Would you say there's hope?
Oh yes, there's hope. There's hope. The government of Ghana recently announced a $2.5 million plan to build a hospital in every municipal in this country. The aim is to improve upon the doctor and hospital distribution around the country, right? So as to shorten that ridiculously long waiting time. They also plan on implementing a new payment system so as to clear outstanding debt and to also ensure the timely release of the allowances and payments of doctors.
Thank you so much, Christopher, for that.
All right, thank you for this opportunity.
And moving from Africa, let's go to the last country with us today. It's Iran. And we have Hamid, who's going to talk about it there. Hamid, are you there?
Hey Bassam, how are you doing?
Hi Hamid, I'm great, thank you. I hope everything is great in Iran.
Yeah, everything's fine over here, thank you. Just like Haji Bujian, you know?
That's great. Okay, are you ready?
Yeah, I'm ready. Let's start.
Alright Hamid, tell me about medical ethics in Iran and what topics are you talking about today?
So, let me answer to this question in two parts. The first part is medical ethics in Iran. Medical ethics has a long history in our country, and great Iranian physicians laid a special emphasis on teaching and practicing traditional ethics. In recent decades, great strides have been made in medical ethics, especially in the fields of education, research, and legislation. As you know, Iran is an Islamic country, so the application of medical ethics for the issues is usually based on Islamic teaching and Islamic laws for sure. Actually, there are some legislation on different topics in medical ethics, such as Embryo Donation Act, and there are topics which has not been discussed yet in the parliament to have legislation, like surrogacy. And it's allowed in country, surrogacy, it's allowed in country, but there's no legislation to govern that. And about the second part of your question, we have lots of topics in medical ethics, but today let's talk more about brain death, organ transplantations, and abortion.
Great, let's start with abortion. Is it illegal in Iran?
So, before I answer to this question, let me tell you something. That what I'm telling you right now is just like not my personal point of view. I'm just like making the medical ethics terms in Iran more clearer. So I'm just like telling you the government's ideas and laws. So they are not my personal point of view. But the thing is that in the medical ethics, our personal point of view is not that important. And what we have to do is just like following the rules and guidelines and doing acting based on the local laws. So in medical ethics, our personal point of view is not that important. Before answering the question, let me do some case studies together. So let me go to 4 examples. The first one I'm asking you is that we have a girl who got pregnant without the parents knowing that, and she wants to do abortion. Would you do it?
Actually, I might do it because it's her choice. Unless the baby's heart has started to work, then maybe I would change my mind.
So yeah, basically I have same opinion like you, but the thing is that we have 4 core ethical principles in medical ethics that we have to follow them. The first one is autonomy, that we have to respect the patient as an individual and to honor their preferences. But the second one is beneficence, that we have to decide what's best for society. And, it traditionally patients' interest supersets, and the things that it may conflict autonomy. So in this case, we can't do the abortion. It's right that the autonomy tells us, okay, we have to respect the patient. The patient wants to do the abortion, but the beneficiaries tell us that we can't do it because what's best for society is just like based on laws, it's forbidden. So we can't do it. Let's go to the second case study. We have a girl that doesn't want to do abortion with the risk to life. Actually, she can't do the therapeutic abortion, but she refuses to do that. So what will you do?
I think that's her choice also.
Exactly. That's a good answer. The thing is that we have to respect her decision. We have to explain the risks and everything to her, but after that, after all, we have to respect her decision. That's a good answer. So let's move on to the third case study. The thing is that a bleeding, unconscious pregnant woman whose husband says save the baby over the mother versus parents who say save the mother. Who would you save?
No, I would honestly save the mother over the baby.
So yeah, this is what I'm thinking too. But in these cases, we have a term that is surrogate decision makers. In the cases that the patient lost the capacity of making decision, the surrogate decision makers has the right to determine the patient's decisions if she or he had the conscience to do to make the decision. And this surrogate decision makers has the some priority. So the first one is husband, and the second one is adult children, and then after the adult children is the parents and then siblings. So in this case, because the priority is with the husband and the husband said that okay, save the child, we can't save the mother, unfortunately. So we have to try to save the child first, and after that we have the right to save the mother. And the last one, the last case study is that the family asked to keep the person on life support. Will you listen to family?
Yeah, I would actually listen to them and keep it on life support.
Okay, this is so complicated, I can say, case. The thing is that, okay, the family tells us to keep the person on life support, but we did all we can do on the patient and there is nothing more that we can do. And the thing is that the person, for example, is brain dead and we can't do anything more, and okay, the family is just like deciding to do, telling us to keep the person on life support. In this case, we have to bring the case in the ethical board of the hospital or the, for example, organization that we are working. So in ethical board, they have to, for example, discuss about the case, and then there they can decide if they keep the person on life support or not. And if they decide not to, then what the family says is just like, unfortunately, we can't listen to them. This is it. So let's go back to our question.
Let's move on to the next topic. Can you tell us more about brain death and organ transplantation?
So about this question, organ transplantation has a long history in the Islamic Republic of Iran. And the country has one of the most successful programs in the Middle East. Actually, ethical problems associated with organ transplantation have been important issues in recent years all around the world. Altruism in Iran, based on religious ethical teaching and the traditional cultural value of helping fellow human beings, have a significant place in the context of organ donation. As I said, medical ethics highly affected by Islamic laws, and we have an Islamic term. We have a term in Islam that mentions whoever giving a life to a soul, it's same as giving the life to mankind. So you can bet and you can guess how this organ donation is affected by this Islamic term and how is the situation in Iran.
And would you care to tell me about the procedure?
So, actually, based on Iran's law, cadaver organs and tissues and organs of related persons can be used for transplantation if the person expressed in his or her desire to donate organs, or with the consent of his or her family and definite establishment of brain death by a specialist. This is so important. So anyone, and I have to add this, anyone can get the donation card after 18 years old, so the organs can be used with their own consent in case of actually brain death. Usually, donation is assisted by charities, and there would be a gift to the donor as well. This is it.
Thank you so much, Hamid, for sharing with us about this information.
Yeah, thank you so much, Bassam, for this opportunity. Take care. Thank you.
So, ladies and gentlemen, we've reached today to the end of our podcast. I hope you got a lot of information about medical ethics in different countries, and maybe we can see you more in the future. Until then, take care and good night.